What is HRT? HRT stands for hormone replacement therapy and refers to the use of estrogen, progesterone and sometimes testosterone to relieve menopause symptoms. These hormones are all produced in the ovaries, but during and after menopause, as the levels fall, women start to experience many of the symptoms that are common in menopause. Loss of estrogen is also associated with many medical conditions that occur after the menopause, including heart disease, osteoporosis or bone thinning, Alzheimer's disease, and muscle and joint degeneration. Estrogen loss is also associated with the changes in fat distribution that many women experience, with fat being deposited around the abdomen. And lack of estrogen is also responsible for the changes that women see to their hair and skin as they get older. The aim of HRT is to replace the hormones that are no longer being produced, in much the same way as happens when we prescribe thyroxine for an underactive thyroid. Replacing these hormones relieves many of the symptoms that women experience during menopause and reduces the risk of the medical conditions that I've just described. HRT comes in several forms, including patches, gels, sprays or tablets, and consists of estrogen and progesterone either as combined preparations or in separate forms. The type of HRT that is prescribed depends very much on an individual's personal preference, their medical history, and also their particular circumstances. Women with a uterus are usually given a combination of estrogen and progesterone, because estrogen, when given alone, causes the lining of the uterus to build up, and this carries a risk of cancer. Progesterone counteracts this. Women who've had a hysterectomy or who've had their uterus removed don't need to take progesterone and can have estrogen-only HRT. Women who are within 1 year of their last period or who are continuing to have periods are usually prescribed cyclical HRT and so continue to have a monthly bleed. Women who have not had a period for a year or more will usually be prescribed continuous HRT with no monthly bleeds. However, what's best for an individual depends on their particular circumstances, their medical history, and their preferences.